Hello and welcome to the Healthful Mind Clinic YouTube channel. My name is Alexa Warner. I'm the clinic director and I'm also a hypnotherapist, coach, counsellor and mindfulness teacher, amongst other things. And I specifically work with people that are suffering from chronic pain, illness, anxiety and emotional difficulties. So today I am here to show you a masterclass that I ran quite a few months ago, pre-COVID, so last February I think it was, as part of a Freedom February whole month of activities that I was doing. So bear with me a little bit while on the introduction, I'm talking a little bit about that, but I think you will find this very, very useful if you are someone that is struggling with chronic pain or that you're caring for someone that's in that situation. Enjoy.
Morning. Happy Sunday morning. I hope you're feeling good this morning, but if you're not, I hope I'm going to give you some really valuable advice of how to feel better. So we are on day 16 of Freedom February, but today is a little bit different because today is all about chronic pain. That also applies to chronic health conditions such as fibromyalgia, chronic fatigue, even things like MS, Parkinson's, endometriosis, arthritis. There's a whole host of health conditions that this may apply to. So if you or anybody you know that are suffering from any sort of repetitive acute pain, such as things like migraines, or that you suffer from constant pain, so chronic pain, then I hope today I will give you some really valuable advice, some understanding, and a way that you can resolve it. And also the biggest understanding really is that I know that if you're in pain, you've already tried everything. And I've heard that many times. I've been there too. I literally thought I had tried everything, the weird, the wacky, the wonderful, the mainstream, but it hadn't worked for me until I tried this. And I'm not saying I'm pain free, because I'm not. I have some health conditions that will still continue to cause me pain, but they do not affect my life, or they are absolutely nothing like they were. So we have to be realistic here that if you have a chronic health condition that cannot be cured as such, then it is about really still having a full, happy and as active a life as you possibly can, and allowing that chronic illness to slip into, the background, as it were. So as I say, if you or anybody you know are suffering from any kind of pain, then hopefully today will help you. So please do share this. We're going to be here for a little while. I don't know how long it's going to take, but half an hour or more, I would say. But let's see if we can aim for half an hour. I'm happy to answer questions afterwards, so just type them up in the comments box and I will get back to you. I also, for anybody at the end of this that thinks they might like to know some more to work with me, then I have booked some space in my calendar this week for you to go directly to book yourself a free 30-minute complimentary call. So I am here for you wherever you are, because I work online like this. Well, not quite like this. We work through Zoom or Messenger, whatever works best for you. Or you can see me in my office in Wimborne. But forget all that for now. Let's dive in and give you some really valuable information. I have made a few notes today because I want to make sure that I cover everything and that there's a good structure to it. Now, had I had more time, I would have created you a webinar, but this is my version of a webinar. So rather than slides, I've got my notes down here. So very unprofessionally so, I have to look down every now and again. So let's look at where you're at the moment. What does it feel like to suffer from this chronic pain, this illness? Where is it for you? And what are your belief systems around that? So let's look at some of the categories. That if you have, for instance, had a back injury, that might be that you actually had an accident, such as a car crash, whiplash, something like that. Or it may be that you had a slip disc, prolapse disc, that you've got degenerating spine, degenerating discs, prolapse discs, trapped nerves, anything like that. It may be that you have always suffered from headaches and they've escalated, and that now that you have migraines, or that these headaches have become almost constant, impacting on how well you feel able to do your life and all the things that you enjoyed. Maybe that you have a condition like arthritis. Maybe you've had knee or hip surgery and you were hoping it would have made you better than it has. Or maybe you are waiting for surgery for something. But that doesn't mean that even if you're waiting for surgery, that you can't make improvements now, and actually things that would really help you after the event as well. I recently had to have hip surgery. I have a tendon issue caused by a hypermobility condition, and I've only after the surgery I took one paracetamol. I haven't had to take anything else. Hopefully if you use these techniques, you wouldn't have to resort to drugs as well, or not many. Okay, so what have you tried already? You've no doubt been to the doctors, had a diagnosis, or you're looking for a diagnosis. That diagnosis may be that you've had x-rays or scans. Now, I am not in any way dissing any doctors or information, but when you go to a surgeon, that surgeon is looking for, is there something that I need to operate on here? So that's his perspective. Similarly, that when you come to me, I'm looking at, is there something in their background, in their upbringing, in their thinking, in their thought processes, or their beliefs, or the past traumas that they've had. That's my focus. So we all look from the perspective of whoever you go to. If you go to a GP, they're going to be looking at what medication can I give this person. There's a lot of protocol now about what has to happen before they can send you to orthopedic surgeon, a back specialist, something like that. Partly because the NHS are really starting to recognise that actually your emotional health impacts so drastically on your physical health that often they can, if you address that, you can never need to go and have that back scan. But once you've had a scan for whatever it is, and for people that have fibromyalgia, ME, endometriosis, Crohn's, anything like that, you've no doubt been through loads and loads of tests. Some of those tests, and for a lot of people, fibromyalgia or ME in particular, will all have shown up normal. For those of you that it hasn't shown up normal, then you have a whole belief system around the diagnosis that you've been given. But we are all unique, so we do not have to all be the same just because we've had the same diagnosis. Okay, is this making sense so far? So what have you been diagnosed with, if you've been diagnosed, and what are your belief systems around that? And whatever your belief systems are, you will then adapt your thoughts, your feelings, your behaviours, your expectation, your imagination, but also what else have you put in place? So it might be that you've been to osteopaths, physios, podiatrists, rheumatologists, reflexologists, massage therapists, all sorts of people like that. You might have had Reiki, you might have had, you might be taking a lot of painkillers. Now that's a whole webinar in itself. I will touch on that in a minute as to the usefulness of painkillers managing and resolving chronic pain. So, where are you at? That it's important that you recognize that, because it is actually some of these things that will be holding you in this space of pain. Now, you might want to shout me down on that, and I totally understand, because actually, and I've been there too, people are very defensive about their pain. Now, pain is part of your defense mechanism. So it is completely natural that you would be defensive about it. Your body, your brain will be thinking that whatever pain you are in, it is keeping you safe, that it is giving you very, very valuable information. Okay? It needs you to know there is something wrong and there might be some things that you really shouldn't be doing, at least from the perception of what the information going to your brain is. But that might not be so, and I will be looking a little bit more into why we get this overreactive system and overreactive defense mechanism. So I'll tell you a little story at this point. A few years ago, quite a few years ago, maybe about 15 years ago, I did a certain process. I went for a weekend of intensive training. You weren't allowed to talk about what you'd gone through. You weren't allowed to talk about your own triggers, your background, what had happened to you in the past. None of that was addressed. It was just basically reprogramming you to do things differently by using this stop command. And actually the stop process is a process I use in one session, not over a whole weekend. But the idea was that every time that you noticed that your thoughts or your feelings went towards your pain, you said a very firm stop. And then you had to go to a happy place, if you like, to a memory of when you were really well. Now, I've actually been, I don't have many memories of that. I've had a lot of anxiety from birth, really, because of things that happened to me, and also a lot of illness from very early on. So I found that those memories were overriding my positive memories. Had I known at that point I could have just used my imagination and that would have been as effective, then that would have been great, but I wasn't told that. Anyway, at the end of the weekend, she was like, well, you can go and eat whatever food you like. So this is me, 35 years, I've been allergic to nearly all food. You can go and live your life as normal. And I'm a bit like, what? Really? If that was the case, I suppose I'd been really unwell at this point for maybe about 20 years. And it was a bit like, if that is the point, and at this point I've tried everything, I've been to everyone, it's like, what was all that about? There was no way was my scientific, I need an explanation brain going to let me let go of my illness through just shouting stop at myself over a weekend. She said to me, you need to do it again if it didn't work. And I'm a bit like, well, sorry, 700, 800 pound for a weekend, it didn't work. Therefore, if I come back again, I still, and you're not telling me any different, I still don't have the belief that it's going to work. And that's the problem, is that because of what we've been through, how much of our life is now sort of associated, but we have a right to a proper explanation, if you like. And because of the way that our brains work, we can't just be told, well, don't do it anymore, and then not do it. Because actually, as soon as you are trying not to do something, you're taking yourself down the pathway that you don't want to go. You need to know that positive alternative. But what's more, you need to understand the science behind why that would work. Why would it switch off the pain? Why is the pain there in the first place? So if I could give you absolute concrete proof that you had a maladaptive pain response, the same as you might have a maladaptive stress response, i.e. overreactive, being triggered by things that it really shouldn't be being triggered by, because it's become so completely hypersensitized because of stuff that maybe happened 1 year ago, might have happened 10 years ago, might have happened 40, 50, 60 years ago even. If you think, oh, well, that happened 60 years ago, I can't change it now. That's not true. But if you also think, I need the concrete proof that this will make the difference. Well, unfortunately, I can't give you that. I can't show you on a scan or an X-ray where you see a picture And you say, oh yeah, okay, that makes sense to me. And because there isn't that proof, that is where it is really difficult to deal with chronic pain, because we are all unique. So whatever way we deal with chronic pain, it has to be bespoke, because it has to be about your issues, about your triggers, about what went on with you. Yes, there's a whole host of exercises which I hope you will have seen over the past 14 days, and you'll see over the next 13 days yet to come, that there are many, many ways that you can switch down this response. But having this understanding has been proven for many people to be the answer in itself. So I hope to give you a little bit more of that understanding today. Okay, so I hope this is making sense so far, that the things that we do to try and stop the pain. We do because they make sense to us, i.e. my muscle hurt, it feels tight. I go to an osteopath, it feels a bit better. 3 or 4 days later, I'm back to square one. Why is that? You know, whatever it is you're trying, I take my painkillers, the pain goes off for a bit, or maybe it doesn't anymore. And a few hours later, the pain is back. Now, all of this is because we are not dealing with the root cause. It is like we are just sticking a plaster on it. Now, if you really badly burnt your arm and you stuck a plaster on it, would it make the pain go away? No. If that plaster had some kind of anesthetic gel on it, it might make the pain go away, but would it make any difference to the injury underneath? No, it wouldn't. So that's the point, that a lot of these other treatments are about sticking a plaster on something. And yes, if you have enough massages or enough osteopath treatments, and I'm not dissing them because I still have my treatments because I know my muscles get too tight. And so to have them reset, and then I continue doing the other stuff. I used to go every week. I now go about once every 6 weeks or so. So that's the difference. Is I'm not saying these things don't have a purpose, because they absolutely do. And in an acute situation, they certainly do. In an injury situation, they really, really do. And I would never, ever, say to someone, oh, you twisted your ankle last week, therefore, we've got to delve into your past. No. It's not about that. Though with hypnotherapy, there are still a lot of exercises you can do to help that pain and to help its healing as well. So I'm hoping to show you or explain to you how hypnotherapy works and why. So therefore, okay, let's recap. If we have the scientific proof of what something is going on, of what's going on with this, i.e. we have the x-ray, we have the diagnosis, we can see it in a picture, then we believe that that is what's causing our pain. But actually what they've shown is that you can have 100 people that could have the same x-ray, and that only 5 of them might be in pain. So what does that say? Why have the other 95 not felt any pain, if that's the problem? You might say, oh, well, maybe their muscles aren't so tight or whatever. Yeah, it's about what is the body doing with the information of what's going on in that area where the x-ray is. For people with fibromyalgia and ME, and often even things like endometriosis, people go through years and years and years of having tests and not really knowing what's causing it. And in that situation, it's the upset, the frustration, the anxiety, that potentially those were the triggers that caused the pain in the first place. Now they're getting worse. Now that lack of an explanation, that lack of understanding is making that pain feel even worse. Therefore, the attempt to try and get rid of it, because you are, if you like, grasping at not having what you've got, rather than relaxing and accepting into a new pathway. And that is actually what we need to do. Okay, I'm just going to go through my checklist to see if I've missed anything on that bit. So we've talked about blocks. The the belief systems, the information that we've been given that block us from actually accepting that some of these more mind-based therapies might be the answer. Mind-based therapy, or these type of techniques, does not mean that there is something wrong with your mind. In actual fact, what it really means is that your systems related to the brain are working far too well. So let's consider the fight and flight response, the anxiety response. Now, there's often a lot of anxiety that comes with chronic illness. So you get sucked into this cycle. Okay, it's very, very difficult not to get sucked into the cycle, because you start to doubt, will I feel well enough then? You remember, oh, this hurt in that situation, therefore should I go into that situation again? So you start developing all sorts of behaviours and beliefs around that actually not only hold more tension, restrict your movement, but then become self-prophesizing because of the anxiety that they then create and the imaginations that we then create around that situation. Okay, so I've slightly lost track there a moment of, so yeah, mind-based therapy, it doesn't mean there's anything wrong with your mind, it is just overworking, and therefore often also creating a very busy brain, because we are desperately trying to make sense of this rather than actually peacefully trying to move down a different pathway, down our healthy, happy pathway. It's like it's so all-consuming that we forget how to feel well. Our mind forgets, but our muscles forget, our nerves forget, our chemical responses, our neurochemicals, the whole process almost gets forgotten, because there's so many triggers then that take us back where we really don't want to go. And it's a bit like trying to move forward while looking backwards. All you can see is what you've had before, and actually your perspective of the future is still from what you've had before, rather than it being this new, healthy, happier, more free future. Okay, so let's look a little bit at why you got sick in the first place. What might have happened to you that have created this pain or this chronic illness in the first place? Okay, so we've looked at what you've tried to do about it and why it hasn't worked, and the fact that one reason why it hasn't worked is the fact that it's taken you towards what you don't want rather than away from it. Okay, but why is it that some people can go through the exact, or what appears to be the exact same situation, and they recover? So why can one person have a slip disc and be back on their feet within a few weeks, or, you know, they say my back has gone into spasm for some reason, and other people 6 years later they're still completely racked with pain, and it's down their legs and it's up higher up their back? Why does one person react a different way to the other? Well, a lot of that is to do with what did happen in their past, and therefore how reactive their defense mechanism is. So our defense mechanism, as I mentioned earlier, is there to keep you safe. This is your immune system. So that's the chemical processes of killing the germs that come your way. It's also the so tiredness, chronic fatigue is very much a part of your defense mechanism. It's saying rest up. Pain, acute pain when you've injured yourself, it's there to tell you to rest up, to not move that, to keep your weight off that injured part, because it needs that time for the tissues to heal. But that's not the case with chronic pain. It's very different. So what else is the defense mechanism? Depression is when it's gone way too far and it's like gone into freeze. It's blocking off. I can't deal with any of this. And anxiety, of course, is part of your defense mechanism. That fight and flight, get out of this situation, warn you that you're in potential danger. So when you know that the defense mechanism is what causes the pain, and it's there because it perceives you to be in potential danger, that's when we can start unraveling it, because are you in potential danger? If that danger was actually an emotional danger, i.e. maybe you have PTSD, maybe there's complex and traumatic, sudden onset PTSD. So PTSD, we used to associate it much more with an accident, maybe a soldier, that type of thing, where something dramatic happens and then they get triggered into it, they get flashbacks and things like that. But there's much more understanding now about complex PTSD, which is what's happened to you in your past. Have you had what we call big T's and little t's, big traumas, little traumas? So a child, especially a child under the age of 2 or under the age of 7, doesn't necessarily have the understanding when they get traumatized by something. So I had the trauma of, one, I was a twin and my twin died and was miscarried. Now, okay, you could say you were a fetus, what did you know about that? I didn't as such, but there's a lot more understanding that the impact that can have upon, for me as a growing baby, I knew there was someone there, or and also absorbing my mum's emotions, because she thought she was pregnant and then she thought she wasn't, and then she was upset, and then, oh, I am still there, And then when I was born, after a couple of weeks, my mum wasn't very well, so I was taken away from her. Now, they understand a lot more that really you should keep the baby with the mother at all costs now, if it's at all possible. But in those days, going back 54 years, it was different. And when I came back to her, I kind of fought her. And so it created an immense separation anxiety with me. And again, that wasn't really recognised or understood. And then I didn't want to go, I didn't want to be away from her. I didn't want to go to nursery. I didn't want to go to school. And then other things, because of my behaviour, other things became more traumatic. For instance, then I started to develop a lot of allergies. So there's my defense mechanism kicking in. I also have some genetic conditions, hypermobility spectrum disorder. Now, whether that was switched on or off, Bruce Lipton, The Biology of Belief, I posted a video up 2 days ago about that. Potentially my hypermobility genes were switched on due to that trauma as I was developing. So had that not happened, then maybe the other stuff wouldn't have happened. So it becomes, if you like, whatever's happened to you, a perfect storm for then getting sick. So I struggled big time, but by the time I was 14, I got glandular fever, and that was sort of a massive trigger for me. I went way downhill after that. There were so many things then that just made me feel so ill, and getting through school, which already was an anxiety for me, now became even a bigger trauma. So all the while, this is putting immense stress on my immune system, on my defense mechanism, because it's firing every day, all the time. And then you develop more fears, and it grows and grows until by the time I'm 19, I am so ill I can no longer work, I can barely walk up and down stairs, I can't digest food, and then my microbiome in my gut goes wrong because everything starts to go wrong. I don't produce the right enzymes to break down the food, I lose vast amounts of weight, and then I have to have surgery. And I get a really bad infection from the surgery because my immune system and my defense mechanism is already on complete overwhelm. And then, the story goes on from there. But if I hadn't had a lot of that, then I probably wouldn't have ever got to the point where by the time in my 40s, I'm on crutches, registered disabled. Yes, I had slipped discs, but did I need to then end up on crutches for 6 years with severe nerve pain and things like that? Who knows? I managed to really change it within a month of using the techniques that I now use. just going to initially NLP and hypnosis and learning some breathing exercises and learning the fundamentals of understanding, getting that new perspective. Now you will have your own story. Your story is going to be unique to you. It may not be a long story, it might be a short story, but whatever it is, there will have been a reason why your defense mechanism decided that it was a good idea to switch on pain. Now, just going to address one other thing. There's something called ACEs. I've talked about this before. I posted a video up for that, I believe. Adverse childhood experiences. You may just have had emotional disturbances. I say just. And what the body can sometimes learn to do, even say, as it doesn't even have to be in childhood, but say you were in a difficult marriage, say you cared for your mother while she was dying and you had immense stresses over the course of a year or two or more. Maybe you've had cancer and the trauma of all that you've been through there, and the treatment, not to mention the treatment, all of that can be enough to trigger this hypersensitive defense mechanism. And if there is emotion there that is unresolved, as in, oh, I should be so over that, or I have no way of really understanding that was as a child, I didn't even know that I felt like that about it. What the body can sometimes do is to create pain as an alternative to that emotional pain that it can't do anything with. So if there's prolonged emotional pain that just is, sort of, that you can't rationalize, that you can't make sense of, then the body may create a physical distraction in the way of pain. Because then it's kind of like, its logic, if you like, is not only has the defense mechanism become hypersensitive, but now I can take a painkiller and all those nasty feelings will go away. Okay. Which is why a lot of people with depression also get chronic pain and anxiety. That also with the tension and whatever. Sorry, I'm just going to grab my water before I lose my voice here. So there is a book. I don't know if this will come out in reverse because it looks like in reverse to me here. Hopefully it won't. John Sarno. He, if you like, is one of the leading people in understanding the emotional aspects of pain. Now, this book is okay, but it is for a selective type of pain, okay? The people that he sees, he knows what his process, and he explains this in there, his process is assessing that they are suffering from emotional issues and that's why they've got the pain. So it is specific to that, and not everybody that's suffering from chronic pain is suffering from emotional issues. Sometimes, as I say, it's not that you had a bad childhood or anything like that. It's this overreactive defense mechanism, and that can come on even from having a really bad dose of flu, from having surgery. One of my little traumas, if you like, was being stung by a poisonous fish on holiday when I was 18. Left me paralysed with pain up one side of my body. Had loads of injections. No one spoke English. Don't know what happened. That was sort of a point when I stopped being able to digest food and started to react to everything. Couldn't drink alcohol anymore. Really bad reaction to that. So that was another big turning point on my health's decline. So there is another book, Life After Pain, which is great. I'll post these up afterwards. And this explains the different types of pain. He does address the work of John Sarno, but it also helps you realise that there are other types of pain and other triggers. This guy is a medical doctor as well, so they both are, and he explains more in the different types of pain, and in my course we look more into that, so it helps you to understand what's happening in your body, because as I say, we're all unique, our background is all unique, and therefore how we address it, as much as there's the common denominator of dealing with this this hypersensitive defense mechanism. Yes, there's exercises that work for everyone, but if we're going to deal with your particular traumas and issues and the reasons why it happened to you, then it has to be bespoke. Okay, this is my other Bible, if you like. Hypnosis for, you can see by how thumbed that is. This is a fantastic book because that's got all the medical research, and I love a bit of medical research that proves why hypnosis works. And a large part of that, this is kind of jumping ahead actually. Let me have a look. Let me just look at my notes. Yeah, I suppose now it does kind of follow on. I'm trying not to jump about too much. Otherwise it doesn't make sense. But okay, let's just recap before I go into that. Not only, so I think you've probably cottoned on because I've said it many times, overreactive defense mechanism, being triggered for a reason. That could be a physical illness or an emotional issue, okay, or an injury, okay, that type of thing, something physical, something emotional, that then resulted in you getting a hypersensitive defense mechanism, and your body for some reason chose pain to be that one. Lucky you. I know it stinks. And therefore the things that you have been doing to try and switch that off have not been working because you have not been addressing the root cause, the underlying thing. You have been addressing, you've been sticking a plaster on it basically, and if it had worked you wouldn't be here. So I think I'm safe to assume that you haven't found the answer yet. Okay, I hadn't found the answer for 40 odd years. When I did find the answer, it made changes pretty quickly, pretty big changes as well. And sometimes, as I say, just this understanding can really shift things. So I'm just going to give you a little bit more of the science. So science alert here as to what actually happens that triggers the brain, and therefore that triggers the pain. The brain triggers the pain, and therefore why the methods I use and what you have to do to actually change it, and why all the techniques I've been banging on about for the past 2 weeks and will do for the next 2 weeks may help you. Okay, so if we are looking at what is the science that goes on with pain, you may have a backache, you may have whole body pain, whenever you may have a headache, you may have no pain at sometimes, and then you go and move and you have a lot of pain, and that might be because your muscles go, moving, what are you doing moving? I thought I told you you had to stay where you are. Okay, so wherever we feel that pain, and we're talking chronic pain here, we're not talking I've sprained my ankle, I've broken my leg, okay, we are talking pain that is not really where we think it is. Some of the pain that we feel is that the muscles have gone really tight. And as I say, that's like to stop you from moving because it's remembering an injury. So if you had a previous injury, those muscles are still reacting as if the injury is there, even though it's not. Okay, so that's one fault that can occur. It can be the messages that then get passed up. So it's called neuroception. You have neuroreceptors in your all over your body. Okay, so they take the sensory information. So if you touch something that's burning, that's the area of that you feel the pain. But what happens is a very quick message goes up to the spinal cord, so wherever it is, it shoots through, goes up to the brain decides what to do about it, sends you a message, and even before you feel the pain you might have pulled your hand away. Okay, that's how good your defense mechanism is when it comes to pain. That's the purpose of it, and we are not talking about turning off that part of your defense mechanism. We have, this will not do that. If anything, it will make that work better because the defense mechanism will not be working so hard and won't be so preoccupied with all this chronic pain that you can deal with sudden onset much easier. Okay, so that's the way pain works. Wherever we feel the pain normally, if there's an injury, it goes up to the spinal cord. I mean, it's a really simplified version. It involves neurochemicals. It releases messages, chemicals that send messages, and you move your hand away, or you stay still, or part of your defense mechanism. It might create swelling or things like that, and that visually as well tells you, okay, that's the area I need to protect. With chronic pain, that's not what's happening, and that is actually why painkillers often do not have any real effect at all. Because doctors' understanding of pain is that if you give them a painkiller, it stops the pain, and that's fine. And it's invaluable in accident and injury and surgery and things like that. But what happens with chronic pain is there is no injury, and the messages, even though they might seem to be coming from the arms or the legs or the back or the head, they're not. It's just the brain overreacting to, oh, my hand exists, therefore it's going to hurt. Oh, my back is against the chair, therefore it's going to hurt. Oh, I prefer my back lying down. Oh, I'm not lying down. Therefore, my brain is going to send pain messages, which is why these types of pains can often move around. It's like, oh, it hurts here. Why does it hurt here now? Oh, God, my leg really hurts today. What have I done to my leg? And then we start telling stories to ourselves as well. And thoughts are only stories. So we might say, oh, yeah, well, I went for a walk yesterday. Maybe I was wearing the wrong shoes. Well, maybe then I'll go and see if I need orthotics or something. Maybe I need to change my shoes. And so we start to tell ourselves lots of stories about this. Oh, I sat down for too long yesterday. Oh, I was sat in that chair. When I sit in this chair, it hurts. Oh, well, I stood up, I was doing this. I lifted the baby differently, or, no, not necessarily. That if you have chronic pain, it is just that everyday movements are being read by your brain as potential danger spots, and therefore it is triggering pain for no reason. Okay, so if you keep giving painkillers for that, it's not going to work, because it's a different system and it does not have the same pathways, and it's not releasing the same chemicals in the same way. So doctors do now understand that their method of giving a different or some more painkillers does not work for chronic pain, but they've done it for so long that it's kind of become the belief system within their patients. And so they too are having to retrain their patients to accept these mind-based therapies of being a much better alternative. So I've been talking for quite a long time. Let's get on to what you can do about it. I know that this is a real skirting through summary, and as I say, everybody's unique, but I want you to know that there is science behind it. There is understanding that the reason why we use the methods that I've been teaching are because it interrupts, it changes, it turns down this overreactive, this maladaptive pain response. Okay, so that is our aim, and that is about the brain. It is not, I say it's not about the body. It is. The brain talks to the body talks to the brain. If you tense yourself, the brain is going to go, oh, could there be some danger there? Right, I better create a bit more pain or discomfort. So if you are sat in an awkward position all day, and your brain connects with that muscle tightness, it will create some pain for you. Thank you very much, brain. But if you can get away from the images of maybe injured spines or some weird disease going around your blood or anything like that, and go to the fact that it is your brain that makes chronic pain, and therefore it is the brain that we need to reprogram. We need to teach it that it is safe. We need to show that within the body, and the body has many ways of communicating with the brain, which is why we use the breath, which is why we use our imagination, which is why we use relaxation. Because when we are in those states, the defense mechanism is switched off. That's positive imagination, by the way, not negative. And That's a good point, actually, because positive imagination is what hypnosis often is. Watch the Bruce Lipton video. That also explains quite a bit about hypnosis. But yeah, we can hypnotize ourselves into pain every day without realizing it. And actually what we want to do is hypnotize ourselves into health, but we need to actually do that consciously to get to our unconscious. So we have to make the effort to actually go down that other pathway, to rewind and rewire. Okay, so how do we do that? How do we switch this off? As I say, your breath, your body, your imagination. And when I work with my clients, the first things, apart from getting everything out in the open so we understand what's going on with them and they understand the science behind it, so they know why they're going to do what they're going to do, otherwise they're not going to do it. They've got to know that there's reasoning and logical, practical reasoning behind it. And actually one thing I never ask my clients to rate is their pain. I ask them to rate their happiness, their enjoyment of things, their satisfaction level on things, like their relationships, their jobs, their physical state, you know, their emotional state, stuff like that, because we want to look at what's good rather than what's bad. And even if they're 5 and it's halfway, and you might think, well, you know, if I say how bad are things today, you're going to be like, oh, I can think of all the bad things. Now they feel really bad, therefore I'm going to say that they're really bad. I might give them 10 out of 10 or 8 out of 10. Whereas if I say how good are things today, you'll look at all the good things. And it has been proven, okay, love my scientific proof, that a happy brain makes less pain. So they can see this on scans, that even just saying positive affirmations to yourself, imagining yourself in a happy place, the pain mechanisms switch down. They actually make the brain becomes less reactive. So pain is all about how reactive certain areas of your brain are. And they used to talk about a pain center in the brain, but there isn't. It's related to all different parts of your brain. So therefore, stress that puts you under immense strain and is overwhelming many parts of your brain, it does not take a lot then to start triggering that into pain and into then illness and malfunction and whatever. So we want to minimize stress. We want to go down this positive path. We want to increase happiness, increase calmness, increase autonomy, a sense of how much in control of us are we, rather than thinking the doctor has to solve this, that x-ray, that medicine, that physio, that somebody else has to solve this. No, this is the bottom line, okay? So this is probably the most important statement I'm going to make. You might not like it, but you made your pain, okay? So you can solve it. Now, that might sound like, no, they made my pain. They did this to me. They ran me over. They crashed into my car. You know, they abused me as a child, whatever. No, your body made the decision, a very, very logical, sensible decision maybe, or a completely illogical one, to make your pain. And when it did that, it set up a pattern. Now, if your body and your brain made that pain, then you are the best person to stop it. You have to change the processes or the way those processes are working within you, or the pain will continue. Because unless you change something, nothing's going to change. And the saying goes, if you want something that you have never had, then you need to do something you've never done. And if you have never been able to solve this pain problem, then you're going to have to do something new. And you may think, yeah, but I've tried everything. Yes, you probably have, but you probably haven't tried this. That's all I can say. Okay, so we use your breath, your body, and your imagination. That is hypnosis. If you think about hypnosis, and it is probably also likely to be not what you think it is. But hypnosis is a state, watch the Bruce Lipton video, that we are relaxed. Our breathing is deep and it is calm. We are in our parasympathetic nervous system, our resting, safe space. And then we use our imagination to see what we do want. We use our imagination to allow ourselves to create a positive future. To, yes, sometimes go back and look at the stuff that upset us and acknowledge, okay, I can see that my memory is creating that. Okay, I can now use my imagination to do what I need to do with a hypnotherapist guidance to change that, to change your perception of it. We can't wipe that memory like it never happened, but what we can do is change the impact it has upon you with lots of different exercises, lots of brain training exercises. So that's about addressing the past. But first of all, you have to know what you want. And therefore, usually about the first month that I'm working with clients, it's very much geared to creating this wonderful, calm and healthier space, a place where you feel really in control. And then we start moving into addressing some of the reasons for it, and then we start moving into actually making this stick. So how is this going to be part of your everyday life? Because actually this is about emotional fitness, and one of the best descriptions of it, somebody said, how often do you eat your greens? Every day? Your 5 vegetables a day? You know, you understand, if you eat 5 vegetables a day for a week, do you then think you don't need to do it for the rest of the year? And it's the same as this. If you have 5 days of hypnotherapy, yeah, you'll feel different at the end of it. But if you think you never have to do it again and everything will be fine, no, it doesn't work like that. And it's not that you have to keep having the hypnotherapy, but you have to keep using the exercises and the perceptions and the imaginations and all the techniques that you learnt within that hypnotherapy session. And all my clients get recordings of the sessions that we make if it's relevant, or I've got genetic recordings that I've made before and a whole host of other resources. So they have everything that they need to make sure that they can continue on this journey. How long have I been talking? Oh gosh, 50 minutes. I didn't manage half an hour. I knew I wouldn't. This is why it needs to be a webinar with slides, so you can print out the slides and stuff. Okay, you need to rebalance, resolve those issues and reset. So know how you want to be and know how to continue to live your life that way. And that's your thoughts, your behaviors, your feelings, your beliefs, your actions, all of that. So think about now, have you got the life you want? Is pain the life that you want, or do you want to step out of it? Have you done everything, or is this something that you have not yet done?
So did that make sense to you? Are you starting to understand a little bit about the relationship between your body and your mind and where your pain is actually coming from? And of course, most importantly, how you can resolve it or at least manage it in a very effective way. So as I mentioned in the video, I do offer free 30-minute consultations where you can share a little bit more about what's going on with you, and I can share how I would approach it. So the link is at the end of this video. If you would like to book a call with me, then I would be very happy to do that. It can be online or in our clinic in Wimborne. Thank you very much for watching.